Tonight, we're speaking one-on-one with Baltimore's new health commissioner about her plans to address the city's health challenges and her advice to pregnant mothers following the president's warning about Tylenol. WJZ investigator Mike Helgren is live at the health department with what Dr. Michelle Taylor is saying. Good evening, Mike.
Good evening, Nikki. Dr. Taylor is a pediatrician, and she says moms need to follow the science when it comes to Tylenol. As for overdose deaths, she has a plan to cut them nearly in half in the next 14 years.
I'm just super excited to be here. I love this community.
Dr. Michelle Taylor, the new leader of Baltimore's health department, was sworn in this week.
Congratulations.
Coming from Memphis, Tennessee. She says she's ready to get to work on the city's toughest challenges.
We have a lot of people here who are dealing with chronic disease. Of course, we have a lot of people here who are dealing with substance use disorder, and our overdose rate is entirely too high.
We asked her to weigh in on the new FDA guidance under the Trump administration against the use of acetaminophen, the active ingredient in Tylenol, by pregnant women because of a possible link to autism. What should people do with some of this confusing advice that they're hearing?
I think the main thing to remind people of is that the science hasn't changed, the data hasn't changed, and just because you may have individuals say something that is outside of that, it doesn't change the fact that medicines that we know that have been researched over years and years are safe to take during pregnancy.
Baltimore has seen a staggering number of overdose deaths, 353 so far this year, which has fallen from 1,043 in 2023. Mass overdoses in Penn North this summer highlighted the crisis.
I believe the mass overdose event on July 10th really shed a renewed light on the need to address this issue. And I feel like it is so encouraging that as a result of that event, over 30 organizations mobilized 500 volunteers to go out to canvass the community, to give naloxone.
The city also has a plan to modernize facilities after an inspector general's report highlighted air conditioning and rodent issues at a city-run West Baltimore clinic, which is relocating most services next month.
To make sure that we could move our employees to a clinic where we could continue to provide services in West Baltimore while making sure that everybody was in good working conditions in a facility that works.
Now, Dr. Taylor is also a breast cancer survivor. She reminds it's important to get screened. She also says that there's free naloxone training for community groups so people can save lives if they see an overdose. Reporting live in your corner at the health department, Mike Helgren, WJZ.
Thank you, Mike.